The triplet combination of BRAF inhibitor, Encorafenib, MEK inhibitor, Binimetinib, with a CDK4/6 inhibitor, the Ribociclib, was the first study with a triplet of TKI in melanoma. You know that the concept is that the CDK4/6 is involved in the melanoma progression, and the hypothesis is, of course, to potentiate the response rate and to increase the duration of response. This was part of a phase 1 trial with the combo Encorafenib Binimetinib with a cohort of patients with this triplet. The results are interesting, but if you look, the response rate was about 53%, not higher than the BRAF-MEK inhibitor in the dual combo. If you look, the disease control rate was 88%. This is interesting. And you know that in general, CDK4/6 inhibitor is able more than to increase the response, to increase the duration of response. Anyway, toxicity was higher with the triplet than the dual combination, with that 21% of patients who discontinued the treatment for toxicity. The most important toxicity was liver toxicity and neutropenia, that is classical toxicity of CDK4/6. The progression-free survival was 9.3 months, lower than the progression-free survival reached by the combo Encorafenib Binimetinib, 14.3. So why the reason? There are several reasons. We had in this cohort of patients with a higher number of elevated LDH, so the bad patients. And again, if you look, the exposure to the Encorafenib, to the triplet, was about 8.5 months. That is, of course, lower to the 16 months with the dual combination. And this was due to the toxicity. So, in general, the toxicity probably and the bad patients escort affected the data. Anyway, the future of this triple combination may be in the bad patients with elevated LDH, because you know that the dual combo in general gives not so good result like in the normal LDH, and in a specific population of patients that together the BRAF mutation has the CDK2/A mutation, because last year, probably you remember that Kit Flaherty reported the data of the COMBI-D and also evaluated the CDK2/A mutation, and in this population, the dual combination went worse than in the wild type. That say, we'll see in the future, maybe something that we should explore in this setting of patients.